Warm welcome to one and all. So here we are again with a new session. Today I'll be talking about hand hygiene. We may think it is one of the simplest topics to be discussed at this platform, but it is having so much of depth that we all need to remind ourselves the importance of this. We are in the era, almost kind of a post-antibiotic era. We know the situation of antibiotics now. Almost all the antibiotics which are available right now have shown some resistance for most of the bacteria, and there are no new antibiotics coming up also. So ultimately, after so many years, we all have come back again to this single most efficient method of hand hygiene in controlling the prevention and transmission of infections. So that's what we are going to discuss or see today. So I'll be browsing through this topic in these aspects. The evidences says the importance of hand hygiene, then the purpose and the types of hand hygiene, what are the different types which are having, and how do we assess the compliance, how do we know that are we following it properly or not, or is it going effective or not, and what are the various options for implementation, and what will be the outcome if we follow all these things. So evidences not just started now, it from almost 150 years before it started with the scientist called Ignaz Semmelweis. So you might know the history about Ignaz Semmelweis. I will not go into the depth of this. So in his time, he had given this finding that hand dips just before going into the surgery or after coming from the mortuary in chlorinated lime had given a huge decrease in the onset of infections. So that was the initial documentation for hand hygiene or hand antisepsis. Then in 2009, WHO, knowing that the importance of hand hygiene, had conducted a systematic review, and based on multiple researches, it has been proven that contaminated hands are responsible for transmitting infections. And lots of guidelines have been laid down at that time by WHO in 2009. Later in 2015, WHO had again implemented a new strategy to control or implement this hand hygiene, namely this multi-model improvement strategy. So this is the strategy which was currently being implemented in most of the institutes or most of the centers, and which shows positive outcome. So before going into hand hygiene, first we need to know what is there in our hands. Then we'll be able to better control in the hand hygiene. So in the hand we have different types of microorganisms. Some are called resident flora and some are transient flora. So resident flora are basically the ones which live on the surface, skin surface, as well as beneath the superficial cells or superficial layers of stratum corneum in the skin. So since they live little deeper, not only on the surface, they are considered as a resident flora, and they are part of the normal flora of the skin, and they are not easily removed by just a single hand hygiene procedure. So in case of surgical hand scrubbing, in that time we may need to eliminate even the resident flora. So that is the only time when we need to target the resident flora as such. So these are the organisms which comes under resident flora, like Coagulase negative staphylococci or diphtherides and propionibacterium. These are part of the normal flora of the skin. Whereas transient flora, they are just colonizers. They colonize the superficial surface of the skin. They are not part of the normal flora. They are not considered to be the normal flora of the skin, and they are easy to remove since they are not underneath any stratum corneum or stuff. So it can be easily removed by a single hand hygiene procedure. So Escherichia coli, Klebsiella, Acinetobacter, and Staphylococcus aureus, and even Clostridium difficile, all these forms as a transient flora. So our main target and purpose is to eliminate this group, transient flora, from the hand. That is the main purpose of doing hand hygiene routinely, except in case of surgical hand scrub, where we are targeting even the resident flora from the hand. So hand hygiene types, so these are the common types every one of us are aware: hand rub, hand wash with soap and water, and surgical hand antisepsis. So before going into any of these three types of hand hygiene, these are the precautions which we need to take or we need to have in our mind before going for any of these procedures. Lesions and skin breaks. Suppose we are having a cut or abrasion in the hand. Should we go in for a surgery or not? if it is a very active lesion, if you have a skin disease and it is a very active lesion, usually it is advised to be away from the patient care activities till the lesions are healed, completely healed. That is the first suggestion. And suppose if you are having a cut or abrasion and we need to go into the patient care area, then definitely we need to cover the wound with the waterproof dressings before handling the patient and before doing the hand hygiene procedure. So what about fingernails, nail polish and jewelry? So this part has been told or communicated in many multiple settings and multiple guidelines are there, but none of us are properly taking into it in the implementation as such. And we all knows nail should be kept short, but how short? How much is as such appropriate and how much is suggested? So they are saying it is 0.5 centimeters beyond the fingertips. Your nail can extend 0.5 centimeters beyond the fingertips. So that's the that should be the maximum nail you can keep. And artificial nails and nail extenders. So many studies have clearly proven the problem of these artificial nails and nail extenders. They have proved multiple organisms growing underneath these artificial nails or nail extenders. So they are strictly a no when it comes to nail. So no chipped nail polish. So they are not saying nail polish should not be worn. Chipped nail polish should not be. The nail polish should not be chipped. So that's what is specifically mentioned. What about ring or wearing watches or the in India specifically the threads which we are wearing in our hands? Is it allowed or not allowed? That is another big question. So once I'll walk you through the steps of hand hygiene, then you will be able to relate better. So as such, as per the guidelines, in your fingers above the wrist, nothing should be there. That's what the guideline says. Ring definitely no. Even for a normal routine hand hygiene or a hand rub, ring should not be there. If at all you have to wear a ring, they are suggesting you can even put it in the necklace and wear the ring, like a marital ring or something. If you are in a surgical team, if you are going for a surgical hand scrubbing, in that case, everything including whichever is there in your wrist, like your watch, your threads, jewelry, bracelet, everything should be removed. Your hand should be completely free from the tip of the finger till the elbow for a surgical hand scrub. So hand lotions and creams. So the problems with hand rub as well as hand washing with soap and water. So soap, you always know that soap removes the oil. It has the detergent effect, so it removes whatever oil which is there in your surface of the skin. So it will lead to extra dryness of the hand, and even the alcohol or other rubs which you are using, even that lead to that will remove the dissolve the lipids layer in the skin. So even that leads to dryness. So hand lotion and creams are always suggested after having multiple usages of hand rub or hand washing. So even in this hand lotion and creams, we should be cautious not to use oil-based creams. There are different lotions or creams which are coming even as oil-based creams which has petroleum jelly as a component. That specifically affects the latex rubber gloves. So even when you are using these lotions and creams, we should be cautious about that. And another important consideration, if we once we go into these guidelines, then we know the depth at which people have thought about the implementation of hand hygiene. So religious and cultural considerations. So we all know that Muslim religion, basically Islamic religion, they don't allow alcohol for anything. So even that considerations has to be implemented. If persons who are following properly Islamic religion, they may be reluctant in using alcohol-based hand rubs in the hospital or places. So in that case, we need to suggest an alternative. Actually, some of the publications have come based on the Quranic descriptions. In one of the Quranic descriptions, what they have told, the Quran even says for curing a disease, anything can be accepted. A man-made thing can be accepted. So in that sense, even alcohol can be used for curing a disease based on Quran. So that publications also have come. So all these awareness has to be given to the population, so that will help in going on with the proper implementation of hand hygiene. So I have put hand rub, like alcohol based hand rub, in a single slide. So here the most important things we need to know here are: WHO says this is the preferred means for routine hand antisepsis. WHO, CDC, and all the guidelines says alcohol based hand rub is the preferred means of hand hygiene for routine scenario. Why? Because they are well tolerated compared to your soap and water. alcohol based rub will not cause much of the problem. They are well tolerated. It does not cause much of irritation or allergies and things, and better efficacy. So compared to soap and water, even compared to antimicrobial soaps, this alcohol based rub shows better efficacy. Shorter application time, so alcohol evaporates after some time, so you need not wait for so much longer time for drying your hands. So shorter application time and no infrastructural barriers. So alcohol hand rub bottles can be placed at any point of care places, so there is no need for constructing a sink and things, and there is no need for water specific water supply also. So these are the specific reasons why this is considered as a preferred means of routine hand sepsis. So what are the different types of alcohol we have? So isopropanol is the common alcohol which is used for hand hygiene purposes. Apart from that, we have even ethanol. So these are the two common ones which are commonly used, and the concentration classically it should be 60 to 80% concentration. So it should not be more than that, it should not be less than that. And the contact time is considered to be 20 to 30 seconds. And how much volume you will take, so that also matters. So just doing hand rub with alcohol does not solve any purpose. So the ultimate purpose is to cover all the surfaces of your hand for the 20 to 30 seconds duration. So to cover that, you need to have at least a palm full of alcohol in your hand. It comes approximately to 3 ml. So when you do one puffing in your sanitizer bottle, around 1.5 ml comes out in a standard container. So there are different bottles. So based on the different bottles, it changes. So ultimately, 2 puffs are needed for a single hand rub procedure. And about this, so hand cleansing with unmedicated soap and water and alcohol based hand rub. So that has been depicted in this graph. So the dotted one is basically for the alcohol based hand rub, and the straight line is the unmedicated soap and water. So if you see the concentration of bacteria in the hand, so it reduces immediately, it reduces much more compared to the unmedicated soap and water. So if you see the difference, it's quite obvious, and it stays like that for quite longer duration also. If you are having this alcohol as a hand rub instead of soap and water, the persistence of effect is also there for a longer time when you use alcoholic hand rub compared to your soap and water. So these are the reasons why alcohol based hand rub is preferred means. Another important point to know is if alcohol is applied in wet hands. So some people have that idea of washing the hands and then taking the alcohol. So basically what it does is it dilutes the alcohol. That is first thing. So concentration also will come down, and there is increased chance of skin irritation. So in the presence of alcohol, in the presence of water, wetness, they say that many studies have proved that alcohol leads to more skin irritation. So the efficacy is also reduced and skin irritation also increases if you are applying it on a wet hand. So comparison of different forms of alcohol. So alcohol comes in different forms. So one kind is a normal one is a solution, just like water based solution. It comes in gel form and it comes in foam form. So which is more easier or convenient to use in this scenario that we can compare in this chart. So the water like consistency is there with solution form. So because of that, it dries fast. It does not stay. It does not take longer time for drying, and it does not stick much in the hand. It's less sticky, and chance of spillage is quite there for solution. But otherwise, all the other aspects, solution is compared to be the better form of hand rub compared to gel and foam. So hand washing using soap and water. So there are advantages for even soap and water. Even though the preferred means is hand rub, soap and water also has quite a good advantage. Like it removes the dirt. If you want to remove dirt, obviously you need to wash your hands with water and soap. You cannot remove dirt by using how much ever of alcohol on your hand. So to remove dirt, to remove organic material, to remove loosely adherent transient flora, and portions of even the resident flora can be removed using soap and water method. All these may not be easily done in case of hand rub. And the time duration usually it takes us around 40 to 60 seconds for an effective soap and water hand washing. So when the hands are visibly dirty, and if the hands are soiled with blood and body fluids, and after using the washroom or after using toilet, and if you suspect there is a diarrheal illness outbreak in the hospital, or if you're handling a patient with any of these diarrheal illness patients like Clostridium difficile or protozoan oocyst and non-enveloped viruses. In all these cases, the hand hygiene using hand rub may not be effective. The alcohol may not effectively eliminate these organisms. So it's always better to use soap and water for a hand hygiene. So what are the other things which we need to take care while using hand washing using soap and water? So bar soap was a commonly used modality of hand washing in previous decade kind of. So they use bar soaps, but it should always be kept dry. If you use the bar soap and then keep it in a pool of water, then the organisms are always going to come up even on the soap, because all these soaps are not going to be an antimicrobial soap. These are all plain soaps, just a detergent soap. It should be always kept dry. Liquid soap, even if you are using liquid soap, now we are in the decade where we are using liquid soaps, so it should be in a closed container. So even in the soap, the microorganisms will start growing. Being a moist environment, it always helps in the growth of more microorganisms. So it should be in a closed container and it should be thoroughly cleaned. Once the container is empty, you don't just refill the soap. You have to thoroughly clean it and make it dry and then again refill the container. No antimicrobial soap. So obviously the purpose of hand hygiene is to eliminate or kill the microorganisms. So everyone's common sense, immediately they'll think antimicrobial soap is supposed to be more effective. But multiple studies have clearly proven that there is no added benefit of using antimicrobial soap, because the purpose was only to remove the transient flora. We are not targeting even the resident flora. So transient flora can easily be removed with soap and water, normal soap and water. No need for antimicrobial soap. And this antimicrobial substances leads to allergies and irritation of the skin quite often. So these are the reasons why we need not use an antimicrobial soap. What about brushes? So you might know, when you have gone to the OT, like before surgical procedure, previous decades, they used to have the brushes. They will brush the hands quite thoroughly. Even now, some places they are doing the brushing of the hands in surgical antisepsis. Even in that case, it is strictly prohibited. Use of brushes, nail brushes are strictly prohibited even for surgical and hand scrubbing. So it will damage the skin, it will facilitate the proliferation and persistence of microorganisms in the skin layers. So no need for using a brush for cleaning the hand. So these are the aspects which we need to know when we are talking about hand washing. So steps of hand rub and hand wash. So most of the steps are almost similar. So out of this, the 6 important steps we need to clearly remember. So hand hygiene steps, it comes in different numbers, but the primary steps are only 6. So starting from this, once you take the alcohol or even soap and water, first your palm to palm should be properly rubbed, then palm to dorsum of the hand should be rubbed, then interlaced fingers. So the interlaced fingers should be properly done, then the dorsum of the fingers. In this step, we are basically targeting the dorsum of the or backside of the fingers. That is the place we are targeting. Then comes the thumb, then the tip of the fingernails. So these are the 6 primary steps of hand hygiene. Be it hand rub, be it hand wash, this is the primary step. So apart from this, drying is also important. So how to dry, we'll discuss in the next slides. So this is a small video which shows alcohol based hand rub technique. So take a palm full or at least 3 ml of solution in the hand, then palm to palm, palm to dorsum, interlaced fingers, then dorsum or back of the fingers, then thumb, and then tip of the fingers. So both hands simultaneously we are doing. So now your hands should be dry. So it takes at least 20 to 30 seconds. If you have used proper adequate amount of solution, it will take at least 20 to 30 seconds for your hands to get dry. So the another important point to note here is, did you see the procedure involving cleaning of wrist, which we always confuse and we always include. As such, in any routine hand hygiene, we include wrist also as part of that. So as per the guidelines, as per the procedure, wrist part is not coming in any of the hand rub as well as in hand washing. So as I told you already, in surgical hand sepsis, hand antisepsis you need to cover including the elbow. So in that case, wrist and everything is coming. So that is the reason why watches and threads need not be removed in case of routine hand hygiene or routine hand rub or hand wash. So soap and water hand washing. Here few things we need to know. So it's always better to have a long levered tap so that we need not touch the hands and close. We can use our elbow and close. So always rinse your hand first, then take adequate amount of soap. Then all the 6 primary steps of hand hygiene should be followed.
हमको भी सर इस तरह से मतलब ऐसे नहीं है. He's moving.
That depends. The full thumb has to be covered. That's all. There is no specific guidelines like it should come in this direction or whatever. That is our belief. So the hand should be dried. How it should be dried? We can use a paper towel. I'll discuss those things next. So how we close the tap is very important. Many times, if the proper awareness is not there, they do full procedure properly for 60 seconds. After doing everything, they will use the hands to close the tap. So that dissolves the whole purpose of hand washing. So that should be there in our mind strongly, that we should not touch the tap again with our hands. It can be closed with the elbow if it is elbow operated tap or foot operated tap, or you can use the tissue to close the tap. So now, can you tell me what are the areas which are missed? So according to different studies, WHO have quoted this study, and these are the common areas which are missed. The dark ones, the dark colored areas are commonly considered to be missed. So can you tell me which step of hand washing or hand rubbing leads to this kind of missing? So I told 6 steps. Can you tell me which step?
Fingertips and interval.
So basically here we are having the thumb area which is quite darker and the tip of the fingers. So as madam had told, the fingertips, that is the last step which was done, and just the last before step was the thumb. So basically your 5th and 6th steps were missed, usually missed, because of that is the reason why these areas are commonly missed. So some of the studies have come out, and what they are suggesting is you can change the order of hand rub and hand washing also. So what they say, after taking the palm full of alcohol in your hand, directly you can dip your fingers in the alcohol, and then you can do the hand rub with the thumb, and then you can start the procedure. So some of the studies have come saying that in that way you will eliminate or avoid missing these areas, which are the commonly missed areas. So drying of hands. So how do you dry your hands? So it's quite important, because if you don't dry your hands after an alcohol use or after an use with soap and water, the moist environment always leads to more problem. It leads to growth of more microorganisms in the hand. And even if you are using an alcohol hand rub, if it is still wet and you are wearing a glove, that will lead to again growth of more microorganisms, and that can damage the gloves also. So by be it soap and water or alcohol or hand rub, hand should be always dried before going into the next step. So the common ones which can be used is paper towel. So disposable single use paper towels can be commonly used. So even in that case, you have to just pat the skin. Take the tissue, pat the skin, not rub the skin over, because that can damage the skin layers and skin cells. Cloth towels. So in some places, if the institute can afford, we can even implement cloth towels, but even that should be single used, and it should also be disposed. It should also be sent for recycling or laundry. It should never be shared by another person. So that is also there. And use of warm air dryers. So we have seen warm air dryers in multiple places. So there are some disadvantages for warm air dryers also. It's slow. It takes a lot of time for your hands to get dried. It is noisy and it requires an electric supply. And airborne dispersal of microorganisms have been documented. So your hands are still wet, and this will lead to airborne dispersal of organisms from your hand. So these things have been documented. So this is not recommended in healthcare facilities by WHO. So what is the easiest method? Yeah, drying, manual drying by just movement of hands. Even that has been suggested by WHO, but that takes longer time. So now we know how to do hand hygiene, what are the different products available for doing a hand hygiene or hand washing and things. So now when will we do? So what are the ideal situations when you need to go for hand rub or hand wash? So WHO has classically listed out 5 moments of hand hygiene. So that it becomes more organized and it becomes structured and it can be easily monitored also. So the primary ones. So before going into that, so if you see this picture, there is a dotted line. So the area within this dotted line is considered as the patient zone. The area outside the dotted line is considered as healthcare area. So patient zone, when we talk about patient zone, it includes just this area, that is the patient and the whatever items which are coming in contact with the patient, the equipment which is in direct contact with the patient, or the patient bed, or the cabin which is just next to the patient's bed. So these are the articles which are there inside the patient zone. This is what we are talking as patient zone. All the other things are considered as healthcare area. So here 5 moments are available. So the first number point is like before touching a patient. So before going and touching a patient, your hands can have multiple organisms from different sources. So to protect the patient, you need to do that hand hygiene before a clean or aseptic procedure. Even in this case, it is considered as to protect the patient. So can you name some clean and aseptic procedure? What do you think are the clean and aseptic procedures?
Any catheterization or dressing.
Catheterization, dressing, or surgical wound, when you're putting a surgical wound, cleaning or dressing, even that is considered as a clean aseptic procedure. Even preparation of food is considered as clean procedure. Preparation of food or handling of food. So we should not just think directly about invasive procedures in our mind. Even the simple procedures are considered as clean procedures. After body fluid exposure, so secretion, aspiration, or disposal of urine containers, all these things comes in after body fluid exposure, and after touching a patient moment, and after touching patient surroundings. So here patient surroundings clearly means the bed rails and the equipments near the patient, and the bed chart, the chart which is medication chart which hangs in the patient's bed, and the medication drawer which is just next to the patient. So these are the patient surroundings. So hand hygiene complaints. So now we know everything about hand hygiene, how to do, when to do, all these things. But even then, the compliance rate is quite poor in most of the places. So what is the reason for the poor compliance? The main reason is it's kind of a complex reasons. It's not a single reason. The lack of motivation. So we know we all are educated, very educated today, we are all motivated today, but how about tomorrow? How about weeks later? How about a month later? How about a year later? So motivation is needed on a regular basis. So constant motivation is the key for proper implementation of hand hygiene. Lack of adequate knowledge. So the in-depth knowledge should be there to implement things properly also. Understaffing in an overcrowded area for 100 patients, 2 or 3 staffs, then obviously they are going to face the issue of hand hygiene complaints. Inconveniently located hand washing facilities, or lack of readily available hand hygiene products, or unacceptable hand hygiene products, lack of reliable data. So ultimately, what we are doing in the hospital as an infection control team, we are going to conduct an audit in the area. We are going to audit and see how much compliance is achieved in the institution. But if the person's healthcare workers are not comfortable with the data, if the administrators are not thinking the data is not reliable, they may not work on more to improve that compliance in the institute. So the reliability of the data is also very important in proper compliance. So poor culture of an healthcare facility. So if a person misses hand hygiene, so how it should be addressed? It should be addressed in a strict way or in a educative way, or how? So that also matters in compliance. So this multi-model strategy to improve compliance. So WHO has come on to this important strategy called multi-model strategy to improve compliance, and this is considered to be the gold standard for hand hygiene promotion. So it has five components, five core components. First is the system change. So system change in the sense, basically infrastructure has to be properly provided. So alcohol based hand rub should be kept available at all point of care places. Then hand hygiene, observation and feedback. So even after providing the proper facilities, it should be observed and constant feedback has to be given to the healthcare workers, so that it will act as a constant motivation and they will be keep on following their compliance. Training and education of staff. So whenever a new staff is coming, or when we are there over the period, we may modify some steps based on our convenience, based on our work pressure and things. So constant education and training is also quite important. Reminders to be kept in the place. So in a busy schedule, we always tend to forget. So if a proper reminder is there in front of our eyes, we tend to remember and do the procedure. Establishment of an institutional patient safety climate. So this is a recent culture which is happening in the hospital, patient safety. So patient safety is considered to be one of the prime factors in a hospital. It should be considered as a prime factor. So patient safety climate, as part of that, hand hygiene also should be implemented. So how are we going to observe? So now hand hygiene, whether they are following or not, we are going to assess. So what are the different methods by which we can monitor or assess that compliance? So the commonest and easiest method is direct observation to monitor hand hygiene compliance. So WHO has given this wonderful form which can be taken by the auditor or infection control nurse, and in person they can go with the form and they can observe the person whenever an opportunity comes, whether they perform that hand hygiene or not. That can be properly recorded in this simple chart. It has all the five moments. They can just check that moment, and whether it was a hand rub or a hand wash or it was missed. So that can be highlighted or ticked. Even the steps can be noted here, whether they followed all the 6 steps or they followed only 2 or 3 steps. Even that can be documented in a direct observation monitoring. So we have so many different mobile applications nowadays which can simplify the process. Instead of going with the form and standing in that place, we can do the auditing in the mobile application also. There are applications like Speedy Audit or iBar mobile applications which are quite useful in conducting the observation. So remote monitoring or video observation. So just by a camera, by installing a camera and observing the video. So you need not go and stand in that particular place while auditing. You can sit in a place and then do the auditing of the recorded video of that particular place. So all these are the different direct observation methods. So indirectly also we can monitor. So instead of monitoring the procedure, we can monitor the consumption of hand hygiene products like your alcohol hand rub, the utilization of the soap, the utilization of paper towels. All these can be assessed. Consumption can be assessed in a particular area, and even that can give an indirect idea of hand hygiene compliance in the area. So automated monitoring of hand hygiene, even that automated monitoring is also there. So electronically the sinks and dispensers can be attached with the electronic devices. So whenever you press the dispenser, whenever you use that sink, it will monitor the time you have spent in that particular place. So it will decide that you have completed the hand hygiene properly or not. So these are the different automated techniques which are also available for hand hygiene. So even though all these methods are available, the direct observation method is the key. It is considered as the gold standard method. Even as a gold standard method, it has few problems like bias or confounding factors. Inter-observer variation. So yeah, I'm going and auditing a person and another person is going and auditing a person. So always there can be some inter-observer variation. So this has been limited by giving out proper guidelines and proper fixed moments, even though the chances are quite there. Care worker monitoring own unit. Suppose if I am monitoring my own unit, then I'll have the tendency to properly not may not be properly auditing that person. And there is something called Hawthorne effect. So observation bias. So when you go with a mobile application or a paper in front of in the ICU or wherever, when you are going and standing there and looking at others and auditing, the moment they see you, they will start following the procedure properly. So that is called observation bias. So all these bias are quite common if you have a direct observation. So there are multiple confounding factors are also there. So time of the day, at what time you are going and doing the auditing. So night time, obviously like nobody will be there. So the chances of hand hygiene may or may not be may be affected in this duration of the day at which we do the auditing. Types of patients and the healthcare facility. So what type of patients? So suppose in an NICU, if we go into a neonatal ICU, then we quite often see that almost 99 to 100% of time they follow that hand hygiene protocol properly, because they know the importance and the effect of hand hygiene in the newborn babies. Whereas in a general OP situation, OPD scenario, we may not see that much proper importance given to the patient. So type of patients also has a huge effect in the complaints. So intensity of care. If patient load is too high, then obviously the complaints can be less. So higher number of opportunities in a short time. So in a very short time, multiple opportunities are there. Then as an auditor, we may have the bias and we may not be able to audit properly. And professional categories of healthcare workers. So usually the ICNs, infection control nurses, are going for this auditing. So if they are going and auditing a senior most professor, then there can be some errors or drifts in the observation. So these are the things which can affect. So apart from this direct observation, as I told you, the other alternative methods are monitoring badges. So this is quite commonly used in the Western countries. So there are different badges available which can be just put on our packets. So it has a sensor. It can display the color also. So if it is green, then it is clean. So yellow is just a reminder. It will just light and remind. And if red color is coming, then it means it will even give a beep sound to remind us to do the hand hygiene. So if you are having it in our packet, and the other sensor will be kept in the entrance of the patient room, the door. So or next to the patient, kind of. So once you open the door and go inside, cross that area and go inside, within 5 to 10 seconds, it will start giving you signal, yellow signal. If you don't follow, after 20 seconds, it will give the red signal and it will beep sound also. So that will be a reminder, so that immediately you will go and do the hand hygiene. So these are basically infrared based. So infrared based sensor is there, and it can even sense the alcohol. So once it starts beeping, you can do the hand rubbing and you can just show your hand in front of that sensor or a badge. It will recognize the smell of alcohol and it will switch off or it will turn green. So this will have a positive effect even on the patients. The patient who is lying there in front of you, if he sees a green badge, then he will also be having a good feel that the hands are sanitized. So even the patient will have a good feel when we are using these kind of sensors. So it has a ceiling sensor. It will real-time employee location can be assessed, and real-time and proactive alerts. So all the direct observation and things, we may not be able to give a real-time feedback to the healthcare worker. If they miss the moment, they miss the moment. That's all. But here it will give the alert at that particular moment of time, so that before touching the patient, the healthcare worker would have definitely done the hand hygiene. So these are the monitoring badges which are available. So for a training purpose, so how do we train? So for effective training, there are new technologies which are available. So this you might have heard, a mini training kit which comes with a fluorescent solution. So use the solution in the sanitizer, rub your hand, and then using this torch, if you show the torch on the hand, it will glow. So it will basically tell you the areas which are properly covered, or some of the areas whatever you have missed that will not glow with the light. So this is used only for that purpose, and it can be used in a UV box also. So dark box, inside that UV light is there. If you put your hands inside, it will glow. If your hand is adequately covered with the sanitizer, full area will be glowed. Whatever area is missed, it may not glow. There are disadvantages of these methods, like if first person, one or two persons, they will try to do the proper procedure. Then after some time, what they tend to do, they will realize the what is happening. They will realize. Then they will take, instead of one form full, they will take too much of solution in the hand. If too much of solution is taken in the hand, just with one or two rubs, even if they don't do all the 6 steps properly, their whole hands will glow when you put inside the UV box. So these are kind of different things which by which we may not be able to properly audit a person. The proper procedure and things may not be audited using this. These can be used as a training models. So there are various technologies which are available in the Western countries. There are some sanitizer, scanning box or scanning machine. It's kind of a Xerox machine. You put your hand inside, and then it will assess all the area which is covered with that solution. So and it will give you the pass or fail result, whether your hand is fully covered or not. Both hands can be inserted into the scanning machine and then seen. And there are devices, portable or fixed devices available. Like if you show your hands in front of it, there is a camera on top. It will record your hands, and it will constantly assess your hand. The procedure which that you are doing is proper or not, and the duration for which you are doing it, is it adequate or not. All these can be assessed by these methods, these automated equipments. So these are the upcoming ones for effective training of hand hygiene. So skin reactions and hand care. So after all these teaching, assessing all these things, even then, if we don't give a proper or compatible, acceptable sanitizer to a person, healthcare worker, they may not follow it for a long time. So we have to address the issues. So what are the issues which can come by using a alcohol hand rub? Before that, the most important thing we need to know is, as I already told you, washing hands with soap and water immediately before or after using an alcohol product is unnecessary and may lead to dermatitis. So in wet hands, if you use a alcoholic hand rub, it is going to be less effective, as well as it is going to cause skin irritations. So hot water used for washing hands. So there is no need. Already so many documents or research articles have clearly said that hot water does not have any additive effect. It actually has a detrimental effect. It will in removing the lipids, more of the lipids, and damaging the hands. So repeated use of soap and detergents can lead to chronic dermatitis. Antimicrobial agents, the fragrance elements or the preservatives which are there in the hand rub, they can specifically lead to skin irritation. And classically, two types of dermatitis have been described in this hand hygiene. So one is irritant contact dermatitis, another one is allergic contact dermatitis. So this is the decreasing order of intensity. Like chlorhexidine is more closely associated with, or more constantly associated with, irritant contact dermatitis, and alcohol is as the least. Even alcohol can cause contact dermatitis, but it is quite less compared to a chlorhexidine product. So allergies. So irritant is just irritating the skin or damaging the skin. Allergy, it can be part of multiple other systems. Like the persons who is having allergy with some particular product, they may have anaphylaxis or other respiratory allergies and things. So it's kind of a overall illness. So these are the products which are quite commonly associated with allergic dermatitis. So again, for just for completion, I'll show you the different charts prepared from WHO things. So again, here the 5 moments are classically shown here. And for surgical hand scrubbing, the newer thing what is coming nowadays is we all know that chlorhexidine or povidone iodine was being used for surgical hand antisepsis. But in recent times, what they are saying, instead of chlorhexidine or surgical, povidone iodine, we can rely even on alcohol hand rub. You can just use an alcohol hand rub for a surgical hand antisepsis also. So different procedures needs to be followed so that their whole elbow can be covered. So WHO has given proper charts or reminders. These can be kept as a reminders in the specific areas. So place where the urinary catheters are commonly used, we can keep this as a poster or a reminder, so that they will know what are the steps which are commonly happening in that area, so that they will do the hand hygiene before these particular steps. So for a urinary catheter, a post-operative wound, how will you care a patient with an endotracheal tube, or for a peripheral venous catheter, a central venous catheter, a care in a maternity unit, so pediatric consultation or a vaccination campaign, dental care, hemodialysis. So all the different areas, what are the moments which were commonly anticipated. So even that has been given out as a poster by WHO. So surgical patient journey. So when a patient is coming into a hospital for the purpose of a surgery, so what all he will go through, and where all you will get the hand hygiene moments have been given in this journey. So this all can be kept as a reminder and places. So what will be the outcome of your all these effort? If you implement this hand hygiene properly in a hospital, you can majorly decrease or reduce the healthcare associated infections, which is the most dreaded problem which you are facing in the recent times. So that can be classically reduced, and also the antibiotic resistance will also be decreased. Thank you.